cards. And the governor has indicated he's going to be speaking for maybe 15 minutes, and then he really likes to take questions. So if there's any questions that you want to give him, write them on the card. And I'm going to ask the board members to kind of look around at your tables and then bring the cards up to me. I'll be sitting over here, and then we'll give the questions to the governor. Successive administrations have always spoken well of the drug courts, but successive administrations, be they Republicans or be they Democrats, never really had the vision or the imagination or the courage to do something different. And it's been a problem for us that while a lot of the programs like the sobriety courts and the juvenile programs, the others have taken off, we've had a really hard time putting together a business plan that seemed like it would work effectively in the major urban centers, doing what drug courts were originally created to do, and that was to deal with the heroin addicts and the crack addicts in the urban centers of America. Quite frankly, while all these administrations had nice things to say about them, they were never willing to put their money where their mouths was, and I think that was the quote that Brian McKenzie had last night. And so I'm very proud to introduce to you the governor of the state of Michigan, Governor Snyder.
Well, thank you very much. Thank you. Please be seated. Thank you. Well, thank you for that warm welcome. That's fabulous. It's an honor to be with you today because I truly appreciate the work you're doing. It takes a lot to be in the criminal justice system to begin with, and then particularly to focus in on substance abuse issues. But it is a great opportunity, and I hope you find reward in what you're doing. What I'd like to do today is share some thoughts with you on the entire topic of public safety fairly quickly, and then have an opportunity to take questions and have a dialogue with you. Because I want to have an opportunity to share with you how important your work is and how it's an important component of the entire reinvention of Michigan. Because all these things add up and come together. And as the judge said, part of this is how do we connect the dots between the work all of us are doing to say this isn't about an individual effort or a piecemeal effort, but what's the vision and strategy to recognize what a great state this is, what great people we have in this state, but how we can do even better to show that we're the best place to be and to create that environment not just for us, but for our children and their children. So this is a very conscious approach to say fixing Michigan was not good enough. It is truly about reinvention because we went through many tough years, but now's the time to be positive, to move forward, to make things happen as a team. And the two guiding principles I work on every day that help guide me is I look to create more and better jobs and a bright future for our kids. Now there are many components to that, and many of these components we started working on last year. Tax and budget reform, local government reform, education reform, health and wellness, talent, infrastructure, the list went on. We actually had a very full year last year in terms of different initiatives. But one I was proud to get to early this year that I just did last week was public safety. And why is public safety so important? Well, it's one of the fundamental building blocks of quality of life. We want to feel safe. We need to have an environment when someone feels safe going out to get that loaf of bread. Or if they have a child, they can feel safe that child can go to school and back. And the challenge we have, the reason it rose to the level of doing a special message, is there are places in our state today people cannot say that. And that's not right. And we need to do something about it. The simple way I described it to the general public was we have 4 of the top 10 most violent cities in the United States right here in Michigan. That's unacceptable. We have 8 of the top 100. And we need to do something about it. And so the program we put in place is something I call smart justice. And what is smart justice? there are three key components. The first one is it's about taking a comprehensive approach. And what do I mean by a comprehensive approach? There are three key elements. The first element is additional law enforcement. We need more law enforcement out there, and we need to work on that. The second piece is reforms to the criminal justice system itself. And that ties into the topic of drug courts and mental health courts, and I'll come back to those. And the third piece is about crime prevention. Because the best way to deal with crime is to never have it happen to begin with. So those are the three key components. Now, what else goes with smart justice? Two other things. One is it should be data-driven. It's not just about hunches or assumptions. Again, those are important things. But let's collect real-time data to know where our issues really are. And I always think it's important to remind people, when I talk about collecting data, we're talking about data on crimes. So we're not just collecting data, we're talking about real people that have had bad things happen to them. The other element, though, is to go where the greatest need is. Use that data and to direct the resources to where the problem's really occurring the most. Again, you'll see in this message we talk about doing a lot in those 4 communities. Why is that? Because their violent crime rate's 4 times higher than the statewide average, roughly. Isn't that where we should be? I've actually had people say, well, what about my city? I said, well, if you were 4 times higher, you would be on that list. And should we go to where the data tells us we need to be, and if it would have been your community, we would have been there. So it's about smart justice. Now let me dive into a couple details that I think are worthwhile, and I appreciate a number of you may have already been part of this initiative in many respects, in terms of helping give us ideas. On the law enforcement piece, it is about more law enforcement and better tools. So we're going to increase the crime lab resources. I'm very proud to say we're going to increase the Michigan State Police by hopefully about 180 troopers. And other things along that line. We're going to actually literally look to embed parole officers in the police departments of those 4 communities, so they can have a real dialogue and a much better dialogue as to what's going on, both good and bad, on how to deal with parole issues. Now, when you come to criminal justice system reform, you're the experts, but I'll share some of the ideas we've come up with. It does start, one of the first things I did talk about was mental health courts. Because one of the major problems we have in our criminal justice system is we lock up people that have mental health issues, and we shouldn't be putting them away. We should be treating them. So we're going to establish these courts in these communities. Again, they've already got pilots going, but we're putting state resources behind them. And the goal there is give them enough resources so they can do intensive enough treatments to deal with the mental health issue and hopefully get them back in the society and the community so they can hold a job, they can have a family, and they can have good quality of life. We all win when that happens. So we're going to focus on that, and I hope that's something that will expand. The other thing I can tell you, that's not the only thing we need to do in mental health, and it's not the only thing in the message, but that's the part we were ready with today. Actually, the Department of Community Health owes me a report by the beginning of July that goes through many other mental health issues on how we can provide better service to the issues, to people with mental health issues, without hopefully them even getting in the criminal justice system. Now, the next one is drug courts. And I'm proud to say we want to be a strong supporter there. And we're going to take a somewhat different approach for at least some of these courts, because again, we have limited resources still, so we need to be thoughtful about it. But one thing I really want to do is, instead of simply saying, here's a grant, here's a cap on what you can do in your court, is let's actually set aside dollars per person going into the system. So you can feel much more confident for those places that they can do all the help they need in terms of therapy, in terms of follow-up, of all the things that need to be done to help people with substance abuse problems also stay out of corrections. So it's a big opportunity. And I bet you're fired up to have that opportunity to show those results. So I'm kind of on your feedback, your thought process, because again, this is something I really want to work on, and if it works, we can do much more. And if there's things we need to improve, we need to hear that. So hopefully there's going to be some time here for us to partner together. So you can give us good direction on the best way to apply this. But this is a significant investment of resources compared to the past, because we want success to happen. We are also working hard on some other reforms, actually, to identify what drugs should be illegal. So that's one of the things we're also working on, is emergency powers to put drugs on the list in terms of new compounds and other devices, because we've run across drugs coming out so quickly, we can't even keep up with how fast they're getting on the market. I learned about this, and I hadn't learned, a drug called K2, apparently we dealt with, and there's already another version out there. We had the whole issue with bath salts that took far too long to get that on the list. So we need improvements there. Another big one, though, and I'd be interested in your response, I'll see if there's any questions or thoughts, is on the prescription drug basis. We need to do something there in terms of better management of that situation. So I'm pleased to say the Michigan Medical Association and the Michigan pharmacists have come together to do a much bigger effort to get physicians on MAPS, which is the Michigan Automated Prescription System. That's actually on our dashboard. As you know, I like metrics. I do dashboards and scorecards for most everything I do. So on our dashboard for public safety, we actually have the percentage of physicians participating in MAPS. And it's only about 35%. I want to get to 100% because I think that would make a huge difference in terms of being able to look for prescription drug abuse. So I encourage those of you that aren't directly involved in this, when you go see your doctor, ask them if they're on MAPS. And if they're not, encourage them to join. So there's a big opportunity there. And then we have a continuing list of lots of things in terms of criminal justice reform. One thing I can tell you, this is not the end of our effort to reform criminal justice. I'm pleased to say, in partnership with the Supreme Court, there's an effort to go on to come up with more new ideas on what we can do to improve the entire criminal justice system. So if you have ideas, don't stop bringing them up. Actually, bring them up now in terms of different ways we can incorporate them potentially in terms of some of the reform process. We want to do things better and smarter. One illustration I'll give you on that note was actually the use of video for like law enforcement officers. How often can we use video instead of asking them to come spend a half a day in court? Where if they could do an appearance on video, could they pull over their patrol car? Could they do it from the station? Could they do it from some location and do their appearance and then have all those extra hours out working with our citizens? And again, still complying with what is the rights of a defendant. Crime prevention is part of this. That's actually one of the biggest elements. A couple elements I will mention is we've got a jobs program for the structurally unemployed in these communities. Because again, the best way to stop crime is to have them have a job so they don't commit a crime. And there's an at-risk youth program. Again, if you're dealing with drug courts, you may have some very good ideas on different youth programs that may be successful. This is a good time to bring those up. A couple other things we're going to look at are how to provide better services to the citizens, though. So I've asked the Department of Human Services to say, can we get some of our frontline staff out of the office and into the school as their work location, or into the church in the community, so they can work much better with their clients and have a case where that client may not need to take 1, 2, or 3 buses to get to a government office. To go with that, though, we also want to revisit the truancy laws in Michigan. Surprised me, I didn't know this, that the truancy laws in Michigan really only apply to 16 to 18-year-olds. Does that make a whole lot of sense? No. So we're really saying, what can we do to deal with young kids that aren't just simply not showing up for school in terms of being proactive there? So that's another area we're looking at. So smart justice is this comprehensive approach, data-driven, and go to places of greatest need. You're on the front lines of that. That's why I'm proud to be here today, to have the opportunity to talk to you. Because again, I think we have really strong components to this program, but to make them really work, it's up to you to embrace them, to implement them, and tell us how to make them better. Because you see where the issues really are. So this is a dialogue that I hope goes on. and actually gain strength and momentum and success. Because if I come back to where I started, we want Michigan to be the very best place. Many of us have had a great life in Michigan and still do. There are other people that would like that opportunity that we can help. But in addition to that, a lot of us have kids or know of kids, and don't we want to have a Michigan where we can say, we put it in better, stronger shape than when we received it, and have that bright future for them? Because Michigan's best days are not behind us. They're ahead of us. And the real key to make that happen is our attitude and our approach. And so I'll end with the motto I live by every day. It's relentless positive action. And what is relentless positive action? That's an attitude when I come to work, is I don't blame anyone for anything. I don't care about credit. Don't take credit for anything. I'm just here to solve problems. What's the common ground where people of very different backgrounds can find some common ground to agree and to say we can put a solution in place and we can move forward and we can be relentless by solving one problem after another? That's what you hired me to do. And that's a goal. By having that attitude and approach, we'll be positive, we'll be forward-looking, we'll be inclusive, and we're well on the path to being a great state again. So thank you so much, and keep up the good work. It's really an honor to be with you.
We have a number of questions. Borrow your mic for just a second. All right. We have a lot of questions. Governor, many of the drug addicts and alcoholics in our programs are also found to have significant mental health issues. You get them clean and then you find out why they're drinking and drugging. Can anything be done to make CMH funding more readily available to cross-addicted people in drug courts?
That's a great question, and that's one of the things I really need your help on, because I have already been concerned about that. We're talking about mental health courts and drug courts. How do we really make the coordination happen? Because in many cases that is truly an issue. So that's something I look forward to it, and I really encourage your association to work with not just the Department of Community Health, but the judiciary. So I'm happy to convene people to say, how do we deal with the intersection? And we'll follow up to get your ideas and thoughts on that. Because again, solving one problem just to have them fall back into trouble again because of they go into the other category is not a good answer. The question is, how do we provide a comprehensive solution to when we get them in the system? Can we solve their challenges so they can be successful? It's actually very similar. Those of you may have run across this in many cases. We find that with normal health issues. Quite often, it's not just one health system in trouble. If you go to a lot of our federally qualified health centers, when you talk about chronic conditions that they have to treat, it amazed me that the average number of chronic conditions is somewhere between 6 and 12. So the same thing applies here between mental health and drug abuse. They're overlapping, so we will have to find best ways to address that.
This is a nice question. Would you be willing to personally attend a drug court session?
Yeah, I'd be happy to look into that as long as I'm not the person being reviewed in some way. I'm always happy to learn, and so that's something I'll be happy to see if it's possible to do on the schedule. I mean, I had good experiences last year. I went to Adoption Day at the Supreme Court. Actually, I didn't get to go up to the courthouse, but I went to the session, and my wife actually went up and got to watch Adoption Day with the adoptees and such. And one thing I am doing that is getting booked soon is actually I'm going to several prisons. So I guess the history of Michigan governors actually going to make prison visits is pretty slim. So actually it's being arranged for me to go to one of our communities and visit several of the correctional institutions myself. So I don't hesitate to do these things. It's more a question of finding the right venue and right time to make sure it's worthwhile for your time.
Judge Louise Alderson, right over there, has drug court in the Lansing City Hall building across the street from your office. She'd be happy to have you there. All right, I've got a whole stack of this one, which so I'm going to try and pull them together. Governor, one of the things that was most imaginative about the proposal that you talked about last Wednesday was that you're changing, in effect, the business matter by getting away from grants for drug courts and instead incentivizing the drug courts to have them be paid on a per head basis to give incentive to the drug courts in the 4 target counties to bring in more people. Would you be willing to consider a similar approach statewide, or at least in smaller communities, at some time in the future?
Yeah, absolutely. Again, that's why I want to get the pilot going, see results and success, and then figure out where to go from there. There are 2 main reasons when you look at our feedback expert. Okay? Continuous improvement. See, this is what we're going to work on. In terms of it, we can really use this as a pilot that then would be carried on. And the same thing would be true going to the concept of the mental health courts. Again, I want to really say, how do we see that? Because there are 2 main reasons. One is these are people. And you know that better than anyone. And it's really a quality of life issue for them that they can be productive members of society if we can help them get their issues addressed. The second one is, and the reason I like all my measurements and metrics and dashboards and all that kind of stuff, and when you talk about pain per person, look at the cost parameters compared to them going in the correction system. If we have them in the correction system, if they actually go to an institution, how many tens of thousands of dollars per year is that versus the investment of several $1,000s on the front end? So again, these are decisions that I don't view as very difficult. It's really getting people educated as to showing real empirical results and then how to follow through.
Thank you. Is this working? Okay. Does your structurally unemployed proposal include jobs for convicted felons?
Yeah, it does. It doesn't eliminate anyone because of their background. Because the way I view it is they've served their time. And what value is it not to be supportive of getting them reestablished in terms of society? That was one thing I didn't mention in terms of the message. We actually are revisiting the Michigan Prisoner Reentry Program. And MPRI did some good things. It showed some improvement. The numbers show that. But overall, I think there was a lot of room for improvement. And one of the simplest things that we're starting with is that the MPRI typically didn't start their programming until someone was 3 months or less before they were released. One of the things I've already announced is we're going to start doing Michigan Prisoner Reentry kind of programming the day they walk into the institution. So again, if you see things that you think could be improvements in what was MPRI or what should be in the future version, we need your input because you do this for a living. I just met with a group of clergy in Detroit yesterday that had a lot of good ideas. And we need to be honest about what we didn't do well. And I'll share one illustration with you. In the correction system is when we had someone in a program that actually was to give them skills or success when they got out, some kind of training or educational program quite often, is we didn't have people talking to people, so we were still rotating the prisoners around so much that we could have someone almost complete an entire program and then we'd transfer them without notice to another facility that didn't have that program. So actually we were preventing them from being successful because we had another program going to say, how do we just shift people around to be more efficient? Rather than recognizing the better value is to have them finish whatever they're doing and then look at the next steps.
Do you support the creation of veterans courts? And there's legislation currently in the House Judiciary Committee. Would you support the adoption of authorizing legislation?
Yeah, with respect to the question of veterans courts, I really haven't looked at that. That's something we'd have to look at. We are committed to our veterans. It's really a question of what could we do in the veterans courts that would be unique, how all that system would work. Because we have a big problem with our veterans in the state. We do not do all the things we should be doing for our veterans. Our unemployment rate for veterans coming back from Iraq and Iraq and Afghanistan is running roughly about 30%. It's way too high. And we need to do a better job of helping them get reestablished into career opportunities in other places. We're also not doing as well on the healthcare side in terms of we have too much of a backlog of veterans waiting to get into our healthcare system in terms of their claims and different things. So we've done very poorly. We rank near the bottom of the states, and that's something we're committed to improving. The court piece, I had not had that brought up.
Thank you. All right. What are you doing to restore funding for substance abuse treatment in Michigan? Our agencies are struggling both financially and spiritually.
Yeah, the question about substance abuse programs. That's something that we'll have to look at in terms of we want to be helpful. I mean, one of the tough things I have to be just really open with people is we had to deal with $1.5 billion deficit last year. And we had to make some really tough calls. But we are now in a position to start reinvesting. But what I'll tell you is what we're not doing is we're not just spending money. Actually, when they were working on the budget and we do financial affairs, I have banned the word spending. Because too often the public sector was about spending money. And people, when I first came to Lansing, after they'd say hi to me, the most frequent question I got is, give me money. And I looked at them, I was from the private sector. I never really said it. I always want to say, so what? If you just want money. It's like, tell me how you're going to make a difference in real people's lives. And how do we measure that? And so that's what we're getting to is, I'm willing, and I want to work hard on investing wisely, not just spending money. So, and I understand substance abuse problems can be very much a positive, but how do we identify the best programs, where they're at, how do we make sure the resources end up effectively, and how do we measure that? So those are the kind of things that you're going to hear as we have this dialogue and discussion about, can we invest more? Sure. Let's just make sure we're investing the smartest way possible and we're doing best practice.
All right, I'm getting signals from the staff that we have to start wrapping this up, but the governor's people apparently is needed elsewhere. But here's a nice question to end on. How do we let you know our ideas?
Sure, I'm happy to follow up with you in terms of that. And there are 2 or 3 ways. For the governor's office, Bill Rustom's the best person. He's our director of strategy. So he's available. But then in terms of some of the people you already deal with, Department of Community Health, Olga Dazo's great. Maura Corrigan for Human Services. Whoever you interface with, go through your normal interfaces or feel free to send them to the governor's office, to Bill, or copy them. Because those are the places we want to hear your ideas. And again, we probably can't answer every single inquiry, but what we want to do is see if there's clearly a trend of things we can pick up on that we can jump on, or as we go through this process, we can learn about. Because it's continuous improvement. The other thing is I really encourage you to use your association. That's one of the reasons you exist, is get together and prioritize your best ideas and ask them to bring them forward to us. Because again, you're the experts. I'm an accountant that got lost. So put your best ideas together and see how we can use them. Because again, that's part of that dialogue of continuous improvement and making Michigan the best place possible. Because your work is incredibly important. So thank you so much for your work. I'll try to follow up on visiting court someday. And have a great conference. Thank you.